This morning, hospitals big and small are dealing with a rise of RSV cases. That means RSV stands for Respiratory Syncytial Virus. It usually causes mild cold-like symptoms, but it can be dangerous for babies and young children.
Yeah, and right now cases and hospitalizations are rising in at least 32 states. There's so many children patients at a Connecticut hospital. It's considering bringing in the National Guard or FEMA to help. Now, nationally, more than 28,000 of the 40,000 hospital beds just for children are in use. Dre Clark has the very latest. Good morning, Dre.
Good morning, guys. RSV cases are overwhelming children's hospitals across the country, including right here in New York City. Cases are spiking earlier than anticipated, and hospitals can't handle the influx of young patients. Emergency rooms are packed and hospital beds are full. As you mentioned a moment ago, the situation is so bad, for example, in Hartford, the Connecticut Children's Hospital is now in talks with the National Guard and FEMA to bring in more resources and to help set up a field hospital, which would be on the hospital's front lawn, again, to handle the influx of patients. The hospital has been operating at overcapacity for the last few weeks. Doctors say the spike in respiratory illnesses involving children could get worse when you factor in we're just at the beginning of the cold and flu season. According to the CDC, cases of detected RSV have spiked by more than 700% since April, from less than 500 cases to an average of more than 4,000 cases this month alone nationwide. Now, with RSV, doctors believe 2 years of masking and social distancing help protect children from exposure to the respiratory virus. But now, with those public health restrictions relaxed, the numbers of children getting infected are suddenly going up. Parents of normally healthy children are suddenly noticing their children are eating less, sleeping more, and their breathing patterns are changing dramatically. Doctors say those are all signs of trouble.
Usually we see 2 or 3 days and then they're back to themselves. The things that should tell you to go see your doctor, if they're not eating well, they're not drinking well, they're not peeing as much as they normally do, are all warning signs. Or if you see like they're breathing really hard, you see them using the muscles in their stomach to breathe, they're really struggling to breathe, or any color changes, blueness around the lips.
Now, doctors advise if you notice these symptoms with your children to call your family physician right away or just take them to the emergency room. In most of these cases, the children can be nursed back into good health, but it's very scary for early on for parents who are watching their children experience these very drastic and severe symptoms. Kelly?
Yeah, certainly concerning. Dre, thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.